Effects of engagement stimuli on escape-maintained behaviors in third-grade students who are at risk of academic failure in math. Previous research has focused on off-task problem behavior that impedes learning and competes with school readiness skills for children with disabilities. This study extends the previous research to typically developing children and supports previous research to demonstrate how brief experimental analyses can be conducted within applied school settings to not only determine the behavior function, but also explicitly define the problem behavior and identify the most effective intervention using an alternating treatment design. The BEA includes antecedent interventions to demonstrate that preferred academic engagement stimuli may be used to prevent escape-maintained off-task problem behavior in 3 third-grade students when math computation demands are presented. As behavior analysts, we may find ourselves working with children within the school setting. With that said, there are 2 federal laws that we should keep in mind: the No Child Left Behind Act and the Individuals with Disabilities Education Act. They are 2 federal laws developed to increase academic progress monitoring and preventative interventions. The No Child Left Behind Act supports the idea that high standards should be established for each student, and means to measure these standards should be readily available. Furthermore, the Individuals with Disabilities Education Act, IDEA, states that students should have free and appropriate access to education that prepares them for the community, employment, and independent living settings. An experimental functional analysis is a procedure used for empirically identifying the function or purpose for a problem behavior. Brief experimental analysis are assessments which identify the interventions for reducing those problem behaviors. The brief experimental analysis permitted identification of differential effects of various components of academic treatment for the participants. Schmidt and his colleagues evaluated the use of brief experimental analysis for an adolescent who exhibited severe problem behaviors when presented with academic demands. The purpose of the current study is to replicate and extend the findings of previous research studies consisting of brief experimental analyses in applied settings. Specifically, a BEA will be utilized to assess the function relation of off-task problem behavior of 3 general education third-grade students identified as a risk of academic failure in math computation skills. Based on these results, several possible interventions will be implemented rapidly based on the hypothesized function of the behavior in order to identify an effective intervention. It is hypothesized that, by providing preferred academic engagement stimuli, the probability of exhibiting escape-maintained off-task behavior will be reduced or eliminated. Subsequently, increases in math fluency and decreases in latency to initiate math tasks will occur. A comparison of treatments will be displayed in an alternating treatment design to demonstrate the most effective intervention for each participant. The participants in this study were 2 female and 1 male third-grade general education students. These students met the following criteria. They exhibited high levels of off-task behavior that impeded their participation in academic programming. They were not performing at expected levels in math equivalent assessments. They were selected as students who would benefit from extra instructional services. They were below state-mandated levels of performance in math, which put them at risk for academic failure, and their parents provided parental consent forms. Ian is an 8-year-old Caucasian male who resides with his mother. Ian receives an additional math support once a day for 30 minutes. Sarah is a 7-year-old Caucasian female who resides with her parents. Sarah receives an additional math support for 50 minutes each day. Isabella is an 8-year-old Caucasian female who resides with her grandmother. Isabella receives additional math supports once a day for 50 minutes. All conditions were conducted within each participant's regular math classroom during normally scheduled math times. Conditions were conducted in a large group with independent work time as normally conducted. Materials included a paper-pencil worksheet and an Apple iPad that had a math program built within. The token economy consisted of coupons and a reinforcer menu of predetermined preferred items that students could cash in to obtain preferred tangibles. The dependent variables in the present study were the number of correct math problems completed per minute and latency of responding. The independent variables were the implementation of 2 interventions as part of the BEA, escape plus engagement stimuli and escape plus contingent reinforcement. Math fluency was determined by measuring the time it took in minutes for each participant to complete a 40-problem math worksheet consisting of 20 subtraction problems and 20 addition problems. Depending on the condition, the 40 math problems were either completed on paper-pencil worksheets or by using the program on the iPad. In terms of reliability, inter-observer agreement was calculated across all phases of the experiment. All sessions were a maximum of 20 minutes in duration, and inter-observer agreement was measured for all participants for the math fluency and latency of responding variables. All recording sessions were conducted until agreement was met at 95% or higher for 3 consecutive practice sessions across both dependent variables. An alternating treatment design was used for this experiment with the use of an initial non-treatment phase. Phase A was the control phase, consisting of free play with various preferences with no demands placed. Phase B was an escape or baseline phase. Phase C consisted of alternating treatment phase consisting of escape plus engagement stimuli plus escape plus contingent reinforcement. Sessions were conducted during each of the students' typical morning math time. Also, the order of the presentation of the interventions across days was counterbalanced and randomized by a random number generator on the computer to minimize sequence effects. Phase D was the best treatment phase, where the best treatment identified in the alternating treatment design was reestablished. Each session was approximately 20 minutes in length, and sessions were conducted once a day across 5 school days per week. Reports from the students, teachers, and parents suggested problem behavior was exhibited to escape challenging academic demands, specifically in math computation. This led to a BEA consisting of control, baseline, and 2 intervention conditions, using a single alternating treatment design. Interventions were selected and presented in a counterbalanced method to help control for sequence effects. A free operant preference assessment was utilized to identify the most effective reinforcer for the study. Experimenters ran 3 free operant trials lasting 20 minutes in duration. The assessment concluded that the iPad was the most effective reinforcer. The escape condition was conducted for 5 sessions. During the escape of demands condition, a math task and demand was presented. Demands were placed for completing simple math computation, as would typically be presented in class. These tasks were pencil and paper worksheets that correlated to the instruction and guided practice. When the teacher gave the instruction to begin now, or when prompted to get busy, latency recording began using a stopwatch. When the student attempted the task, the stopwatch was stopped, and latency was recorded. Each session was approximately 20 minutes in duration. A latency recording sheet was used to record the length of latent occurrences correlating to verbal prompts as described previously. Sessions were conducted during the student's normal math class over 20 sessions. During this session, the teacher was instructed to ignore off-task behavior and allow the student to escape the demand. Other activities and play items were restricted as this condition served as a baseline measure. The alternating treatment design was conducted for 10 sessions across 10 days. The escape plus engagement stimuli condition served as intervention 1 and derived from the control condition, as the iPad was found to be the most preferred item across all students. Academic engagement stimuli was presented by the classroom teacher, and the students were instructed how to use the stimuli prior to large group instruction and practice. During this condition, the teacher presented a number of math problems varying in difficulty to the students. The teacher was instructed to allow the student to escape the demand for 30 seconds following the occurrence of a maladaptive behavior. The student was given a 10-second warning that their break period was ending. At the conclusion of the escape period, which was 30 seconds, the teacher was instructed to approach the child and place the demand once more. The child was not able to escape the demand a second time until one math problem was completed. This process continued until the math session was completed. Recording procedures were the same as in baseline, which were latent measures. The escape plus contingent reinforcement condition served as intervention 2 and derived from the teacher and parent response to a request for preference questioning. Parents and teachers reported the participants enjoyed receiving coupons that could later be exchanged for items within the school coupon store. The teachers explained the coupon exchange prior to implementation of this intervention. The process was also modeled for the students prior to implementation, demonstrating for the students that on-task performance would yield distribution of the coupons at random intervals. During this condition, the academic task was presented normally by the classroom teacher under the same procedures during the escape condition. Sessions were conducted during the student's normal math class over 20 sessions. The teacher was prompted by the primary investigator to ignore off-task behavior if it occurred and allow the child to escape the demand. Following 30 seconds, the child was prompted to return to the task at hand. As in Condition 1, the student was given a 10-second warning that their break period was ending, and they were prompted to complete one problem before receiving another break. During this time, the child was reminded that coupons would be provided to those students that remained on task. Students were placed on a variable interval level of reinforcement for their on-task behavior. Other activities and play items were restricted during this condition, and recording procedures were the same as in baseline. The final phase was a best treatment phase. Following the multiple conditions, the escape and engagement stimuli was deemed to be the most effective treatment. To assist in confirming the validity of these findings, this condition was implemented once more over 5 sessions at the conclusion of the study. The escape plus engagement stimuli condition was ran exactly the same as previous sessions to ensure continuity. The presentation of this treatment served as a mini reversal as it allowed practitioners to see the direction of behavior change compared to the other treatment designs. Results for the control phase revealed that for all 3 participants, the most highly preferred engagement stimuli was the iPad. On each trial in which the students were told to select an item to play with, all 3 students selected the iPad on every trial across the 20-minute control sessions. Now we are going to talk about results for each of the students involved in the study. The measure was the number of correct responses on math worksheets per minute. Ian showed a baseline average of 0.79 problems per minute. In the escape plus engagement stimuli, Ian was able to complete 2 problems per minute. In the escape plus contingent reinforcement, Ian was able to complete 1.4 problems per minute. We then re-implemented the best phase condition, which was the escape plus engagement stimuli, and Ian was able to complete 2.1 problems per minute. Baseline measures for Sarah showed that she could complete 0.65 problems per minute. In the escape plus engagement stimuli phase, Sarah was able to complete 1.75 problems per minute. In the escape plus contingent reinforcement, Sarah was able to complete 1.3 problems per minute. In the best treatment phase, we re-implemented the escape plus engagement stimuli condition where she was able to complete 1.8 problems per minute. Isabella completed 0.55 problems per minute during her baseline phase. In the escape plus engagement stimuli, Isabella was able to complete 1.9 problems. In the escape plus contingent reinforcement, she was able to complete 1.4 problems. In the best phase, we re-implemented the escape plus engagement stimuli condition where Isabella was able to complete 2.2 problems per minute. Our second dependent variable was the latency of responding. For Ian, his baseline average was 210 seconds. In the escape plus engagement stimuli, the latency was 5 seconds. In the escape plus contingent reinforcement, the latency was 35 seconds. Once again, we re-implemented the escape plus engagement stimuli in the best treatment phase, and the latency was 4 seconds. Sarah's latency was 245 seconds during baseline measures. In the escape plus engagement stimuli, her latency was 7 seconds. In the escape plus contingent reinforcement, her latency was 65 seconds. In the best treatment phase, we re-implemented the escape plus engagement stimuli, where her latency was 5 seconds. Isabella's latency of responding during baseline measures was 300 seconds. In the escape plus engagement stimuli session, her latency of responding was 10 seconds. In the escape plus contingent reinforcement, her latency of responding was 95 seconds. In the best treatment phase, we re-implemented the escape plus engagement stimuli, where her latency was 8 seconds. Now that we have talked about the design and the data that goes with the study, I'd like to discuss our main findings. The results of this study suggest that the independent variables, which were the implementation of an escape plus engagement stimulus and an escape plus contingent reinforcement intervention, were effective in increasing math fluency and decreasing the latency of responding and initiating math tasks in third grade general education students. Furthermore, visual inspection of the data revealed that, although improvements in behavior were observed with both interventions, greater behavioral improvements were observed in the escape plus engagement stimuli condition rather than in the escape contingent reinforcement condition. Therefore, these results suggest that antecedent interventions may be effective and perhaps more effective than consequent interventions in decreasing escape-related behaviors in children. Also, the validity and utility of utilizing a brief experimental analysis was demonstrated in the present study in that with the implementation of the interventions as part of the BEA, improved behaviors were immediately observed and maintained in all participants across all settings. Although the nature of the present research design decreases the likelihood that extraneous factors are responsible for the behavioral change, all threats to internal validity cannot be ruled out from the present study. First, in terms of history as a threat to internal validity, students continued to attend school regularly, receiving regular math homework, and received additional math tutoring while the study was being implemented. Therefore, the possibility cannot be ruled out that increases in math fluency and decreases in latency to initiating work on math worksheets were also influenced by the students' increased comfort and skill level with completing math worksheets. Second, in terms of testing as threat to internal validity, students were exposed to the math worksheets 5 times across the baseline phase, 10 times across the intervention phase, and 5 times across the follow-up phase. So before entering the intervention phase, participants had 5 opportunities to complete worksheets containing the target subject matter. This concludes that the possibility cannot be ruled out that the students demonstrated improvements in math fluency and decreased latency of responding simply because they had repeated opportunities to practice their skills in previous sessions. Finally, the external validity of the present study may be enhanced in several ways. One way would be to obtain follow-up data 1, 3, 6, and 12 months following the completion of the study to assess for maintenance of treatment effects for each of the participants. Second, a follow-up study may be conducted to assess generalization of treatment effects to other locations within the student's school and own home. Third, assess generalization of the treatment effects when parents and other teachers or paraprofessionals that work with the student serve as the implementers of the intervention. Fourth, assess generalization of the treatment effects to other escape-maintain behaviors demonstrated by the student. Finally, you can assess generalization of treatment effects to other students not used in the present study